Hey guys, welcome back to Savvy. I'm Dr. Brian Yim from York and Bay Dental Office, and we're here with Dr. Craig Tervit at Burlington Endodontics. Thanks for having us.
Oh, it's my pleasure. You're always welcome.
So, I've had a number of patients see Craig for root canal therapy, and you know what, they come back, and I have to say that root canals is not the most exciting thing in the world, right?
It's very exciting.
But they all come back raving about the experience at Craig's office. And so, honestly, this is the first time we've actually physically met. I've always referred my patients to Craig, but he's a wonderful guy, and I thought he'd be a great resource to help you understand and dispel some of the myths about root canal therapy. So, Craig, the first thing that we need to identify is, why do endodontists exist?
Well, yeah, certain root canal treatments are more difficult than other root canal treatments, and you basically go back to school for a couple more years to become an endodontist, and you get a great understanding of the biology, and then you learn through repetition a lot of the tricks in the anatomy and the basic pitfalls that you can run into, so that you get very, very good at something because you're specialized and you're doing it over and over and over again.
I have to say, too, that in my 20 years of practice, I've come into situations where I felt like this was way beyond my scope of practice, so I can totally identify with that. And it's nice to have you guys to be able to pick up on cases that we wouldn't be able to treat as effectively.
Yeah, and the other great thing, especially for us in the last 20 years, has been the advent of the technology. And we can do it very efficiently because we have good rotary instruments that clean very, very well and fast. But you're also looking at special instruments called ultrasonics that allow us to cut very, very small holes. And then the biggest advent, I think, has been the microscope. So we use a microscope for everything that we do, and there's two parts to it. You get great magnification, but lighting as well. You get fantastic lighting, so you can see what you're doing.
Right. Now, the other question that comes to mind is, a lot of my patients are wondering, what is a root canal? Sometimes they think the root is removed, that they're not going to have a tooth there anymore. So could you speak on that a little bit?
Sure. So when a tooth is formed, you have a big blood vessel, and typically when you have a blood vessel, you have a nerve right beside it. And what happens is there's a cap, the blood vessel feeds the cap, and it actually creates the tooth. The root then forms, and the cells that form the root need the blood supply to form. So basically, when a tooth is formed, you have a little bit of blood supply, some connective tissue, and some nerve fibers inside of the tooth that really, I think, are remnants of the tooth formation. It's a funny spot in the body where the body's not great at fighting bacteria. So if you have a cavity and bacteria manage to get into this space called the pulp, your body has a really tough time fighting it, and usually the tissue, the pulp tissue, dies or degenerates. So in treating that, what you do is you make a small hole in the top of the tooth, and you basically clean the little tube that's inside the root that's filled with tissue or bacteria, depending on the diagnosis.
Now that tube can be more than just a tube.
Yeah, they can be quite torturous. They can have multiple branches and lots of curves. So you have to, sort of think about the anatomy and clean it carefully.
It reminds me of the New York subway system.
Yeah,
it's pretty complex.
Yeah, there were old experiments done in like the 20s and 30s by this guy named Hess, and he put ink inside teeth and then decalcified the teeth, and the complexity blew me away when I started looking at his pictures, because it really does look like a subway system.
That is really cool. So the other thing that we noticed when our patients coming in and they're asking questions about root canals is the fact that they get a little hesitant about root canals. When I tell them that they need a root canal or may need a root canal, it's almost like they smell spoiled milk. They give me this look like, oh, I don't know.
Yeah.
So what is it about the idea that root canals hurt? What do you think about that?
Well, it's an interesting thing, and you have to be very aware of what's going on in terms of the diagnosis. If you have a pulpitis, you've got inflamed nerve tissue, and what's going on is the bacteria come in and dramatically upregulate all the cell signaling. And one of the greatest examples is sunburn. So if you touch your arm, it doesn't hurt you. If you go out and get a good sunburn, even your clothes on your arm give you a pain signal. And it's called allodynia and hyperalgesia. And the same kind of thing goes on inside the tooth when the bacteria get in there. So you have to recognize that and make sure that you give lots of local anesthetic, but then oftentimes you have to give additional anesthetic in different spots or in different ways to make sure that people are really comfortable. And having done this for a while, you recognize very quickly, it's pretty easy to get people comfortable, but you have to take the steps to do it.
I think that's a great analogy, the sunburn thing.
Yeah.
Even with the tooth, I guess the thing to remember too is that not every tooth that needs a root canal needs a root canal for the same reason.
Correct.
So the diagnosis is different, and you freeze it accordingly.
Yeah, and then other teeth you're doing root canal treatment on because the tissue's already died, and you have bacteria inside the tooth, so there's no live tissue. In theory, you could do that treatment without any anesthetic at all.
Right.
I wouldn't do it, but you could, in theory, do that.
The other thing that I've noticed in my research, even just looking online, some people are concerned about the toxicity of root canals and how it may link to other illnesses in the body. Mm-hmm. What are your thoughts on that?
Well, that's an interesting question, and I think that the people who have sort of sensationalized that, or have very poor evidence, and it's a very different perspective than the perspective that I've been trained with. But root canal treatment, all you're doing is trying to control bacteria. The wound at the end of a root that you typically make is about 35 to 45 hundredths of a millimeter.
Wow.
So we're talking about areas that are less than a millimeter. You're cleaning everything as well as you can, and you're sealing it. And people worry about, wow, you're leaving bacteria there. But you have to put everything in perspective. Like, you have 1 billion bacteria in your mouth. And, if you were worried about a very small area of bacteria at the end of a root, I'm not sure where you start and stop. Do you take out all the teeth? If that's really your concern.
Yeah, there isn't too many options, really. If you have a tooth that needs a root canal, it's either to remove the tooth, suffer with it, or to have it treated with endodontic therapy.
That's right. And I think there is really, really good research and good evidence that root canal treatment is safe and effective. And can give long-lasting results.
I think the other thing that I noticed that people are concerned about is that I'll tell them that they need a root canal. They'll say, my dad or my friend, they had a root canal and it always failed. Their tooth broke and they had to remove it anyway. So could you speak on the structural stability of root canal treated teeth?
Sure. Well, we spoke about this a little bit earlier, and we talked that teeth that do need root canal treatment usually have a filling or a big filling or have some compromised tooth structure initially. So you always have to put that in perspective. In the past, root canal treatment, to do it, you had to make a fairly big hole so you could see what you're doing. And I think in making that big hole and cleaning out the root system, because of the tools and the technology, took away a lot of tooth structure in years past. Mm-hmm. And that taking away of tooth structure, I think, made a big difference on the stability of the teeth. I think it weakened teeth. I think in this day and age, with the microscopes that we use and the sophisticated techniques and instrumentation that we use, we leave a lot more tooth structure there, which keeps things strong. And I think we recognize that that's one of the risks and try very hard to keep tooth structure there, to keep teeth strong.
I remember you did one root canal for one of my patients, and it came back, and the hole was so tiny. It was almost like, when you try to get all the clowns in that little Volkswagen Beetle? It was amazing how you did that.
And it's interesting, too, from my point of view, right? Like, I think to myself, well, I'm making this harder on myself. I just make a big hole and go in there. But no. It makes a big difference to me that I've kept it small and kept it strong so that tooth's going to be stable for somebody.
Coming from a restorative dentist standpoint, it's way easier, too. So I totally appreciate the efforts to make it smaller, more conservative, although it may be a little more difficult for access for you.
Yeah. Oh, it is, and it takes a little bit more time, but I think it's well worth it because I think it keeps teeth stronger for people.
Great.
Yeah.
Well, Craig, this is wonderful, but I do have one more question. What's the story behind the frog?
I just liked it. It was one of those ads where they had the thing where you could bid on it, and I thought it was great, and it was for a charity thing, so I liked it. I picked it.
I love it. It's whimsical, it's light, and especially coming into an endodontist's office and clinic, this just speaks volumes about you and what you do for my patients and the experience that you provide for them. So thanks once again for taking the time to speak to our viewers, and also thanks so much for the care that you give to all my patients.
It's been my absolute pleasure, and I just want to say that I appreciate all that you do as well, because you really take care of people.
Oh, thank you, Craig. Yeah. All right. Thanks very much.
My pleasure.
Craig Tervit from Burlington Endodontics. Join us on Tuesdays for our most recent episodes by clicking on subscribe. For access to our other videos, click on Tooth Savvy, the one with my picture beside it, And remember, don't keep us a secret. Share us, like us, also leave some comments. I'd love to hear from you. We'll see you soon.